Hey guys, it's Dan from Rocktape UK. In this video, we're going to have a look at how you can deal with shin pain. There are three common causes of shin pain. Anterior compartment syndrome, which is an inflammation of the anterior compartment where a specific muscle called the tibialis anterior sits. And this muscle works very hard when we're walking and running. There's also medial tibial stress syndrome, which is an ill-defined condition that causes pain on the inner front lower third of the shin. So that's roughly around here. And the pain is usually quite diffuse, so it's not a specific pain, but one which spreads through this region, usually of the distribution of about 3 or 4 finger widths. And then there are also stress fractures. Stress fractures can occur in multiple places, but they can often occur in the lower part of the tibia. Now, if you're suffering from any of these, unfortunately, you're going to probably need to temporarily reduce your running volume, have a look at your training, and maybe make some changes to your gait style. But if you're suffering from medial tibial stress syndrome, that is the pain that was around this area, then you may find that this taping application gives you some significant symptomatic relief. And even better, you can usually apply this tape by yourself, as it's fairly easy to do. So I'm going to show you now how you can apply tape to the front of your shin for shin pain, specifically the medial tibial stress syndrome condition. Okay, so let's have a look at the technique for medial tibial stress syndrome, that is pain around this region on the shin when walking and running. So we're going to measure a piece of tape from above the ankle joint and below the knee, and then cut that tape with some decent scissors. And then once the tape is cut, we're going to round the edges, because if you round the edges, then the tape's probably going to last for longer, because those edges which catch on clothing and cause the tape to peel off. So always round your edges, it means the tape will endure and stay in place for a little bit longer. Tear away the backing paper and stick the tape down just above the ankle joint on the inside of the shin. Okay, if you want another guidance point, try to have the tape half of it onto the shin and half of it there into the soft tissue. Peel the backing paper away like this and stick the tape down like that. Then the last piece of tape goes down with no stretch. This piece here wasn't really stretched, it just came off the backing paper and was stuck down, and then made sure that each end sticks down as well. At no point did I need to touch the glue side of the tape because that would debase the glue. Rub the tape to stick it down and secure it in place. And as I said there, you've got roughly half on the inside of the shin and the other half over the soft tissue. If you've got super hairy legs, guys, then you may need to shave them to get the tape to stick down. My hairs are quite fine, so once I've stuck the tape down and rubbed over it there, it's sitting down and stuck onto the skin quite well, and the hairs aren't causing the tape to lift up on the edges. So that's going to sit there quite nicely and should last for quite a while, and it won't be a problem until I have to peel it off, and then I'm probably going to pull a few hairs off, but that's for another video. Now, we then need to find the most tender point on the inside of the shin, and that's usually around this region, as I've indicated before. All right, and when we find that, we need to just make a note of that and then prepare some tape. The tape's going to come from the back of the leg, over at an angle, and then over the front of the shin. So make sure you cut enough tape. Don't have too short a piece of tape like that. That's not going to work for you. That's going to be awkward and it won't do what you want it to do. If the tape's too long, that's okay. It's just going to be a bit more fiddly to apply. So make sure it comes from around the back and then over the front. Place the tape around the back of the leg. Secure that in place. Make sure it's well stuck down. All right. Now, here we're going to pull the tape over the existing tape with a good degree of tension and, as you can see, at a slightly oblique angle. That's using one hand. Using my other hand, I'm going to hook my fingers around the back of my leg there and approximate that soft tissue towards the bone. So I'm pushing the skin in the same direction as I'm pushing the tape. Okay, and then pull the tape tight, stick the tape down, and then relax the tension. So this last piece of tape goes down with no tension, as you can see there. All right, that's the anchor point. We don't want too much tension on the end of the tape, otherwise it won't stick so well. You may or may not get some creases underneath the tape here, and what that shows is that you've approximated the soft tissue and you've got a bit of bunching up there of the skin and the muscle tissue underneath there as well. So that has created a change in the tissue tension, and that often significantly reduces the symptoms of medial tibial stress syndrome. Okay, so that should feel supportive as soon as you stand up, and once you start running and jumping, you should notice a significant reduction in your symptoms. Okay, thanks guys. That's it for this one. Now it's your turn to give it a go.